This should come as no surprise. Corporations are sowing fear among workers who are being exposed to the coronavirus every single day. Because profit is king, after all, in the great free market, and workers are expendable. The fear is just getting amped up because anytime a worker tries to raise concerns about doing a job in a place without the right protections from the virus, corporations repeatedly have shut them down, either by direct threats saying, do your job or we will find someone else, or more subtle hints, or by making cosmetic changes in a workplace and telling workers, there, all is good, and putting enormous pressures on workers to just shut up and work. And this is happening to people who are overwhelmingly lower paid and can't afford to miss a paycheck. To get a little more insight into the fear at work, it's great to welcome Jessica Martinez, the co-director of the National Council for Occupational Safety and Health, that's National COSH, which is a nationwide network that links the efforts of local worker health and safety coalitions in communities across the United States who are trying to advocate for elimination of preventable hazards in the workplace. So, since the pandemic erupted, Jessica, you know that we've been doing lots of segments on frontline workers and the dangers they face, not just the healthcare workers, but as you well know, because you're in this field, frontline workers is beyond these great people who are in the hospitals who are often shown and given a lot of attention, but we sometimes put a little bit to the side all the folks who are processing poultry, processing pork, who are in the grocery stores. They're all frontline workers, teachers, and you can just go down the
hmm
list. And I know you know this. So I wonder if we can start by saying, what have you seen now in terms of the danger facing workers who are trying to basically say, hey, it's not safe at work. Something has to be done.
Right, right. Well, thank you first and foremost for inviting me to your platform, Jonathan. It's great to be here. Let me explain a little bit about who I am and what our organization is about. So I'm fortunate to serve as the co-executive director for the National Council for Occupational Safety and Health, also known as National COSH. We're a federation of local and statewide COSH groups, known as committees or coalitions on occupational safety and health. And many of our groups are nonprofit coalitions that include worker leaders, labor unions, worker centers, health and technical professionals, and other interested in promoting and advocating for worker health and safety. We are not OSHA. We're not the government agency. I know our acronym sounds very similar to OSHA, but we serve more as a watchdog organization that ensures that both OSHA and other state agencies, as well as employers, are doing everything they can to enforce the rights of workers around workplace health and safety issues. Um, to your first point in terms of the impact of workers during COVID-19, what we've learned is we've been doing this work for many years. Our movement around health and safety has been around since 1970 when OSHA came around and was introduced through the OSH Act. And we understand the importance of worker health and safety is just as equivalent as a living wage for workers. So we've been doing this work for the labor movement for some time now. Now, during COVID-19, what we have found is that this issue has amplified really the importance of providing safe and healthy workplaces for workers. Now, everyone's talking about workplace health and safety.
Mm-hmm.
It's in the mainstream media, something that us who have been doing this work for some year had challenges being able to have these discussions in very popular platforms. We're learning now that what we consider now essential workers um, have always been essential workers, and you're titling them, frontline workers. These are farm workers, meat processing workers, folks that work at restaurant, grocery store workers. There's also a quick connection that it's important to make very early on that many of these workers working in these high hazard, low wage paying jobs in many situations are workers of color. So
Mm.
if we've noticed too that the impact of COVID-19 in terms of infection rate has been significantly higher in communities of color. We know Black workers are being highly impacted. They represent a large portion of correctional workers many times. in the janitorial industries, restaurant industry, as well as immigrant workers.
Mm.
Immigrant Latino workers are also highly impacted around COVID-19.
Mm.
Now, what's happening is that across the country, we're seeing that as states are starting to reopen, we know there's an inconsistency, and some states are fully open, some are slowly opening up. Nonetheless, all these essential workers are presenting themselves at work with a lot of fear of going back to work.
Mm.
There's no real guidelines federally that are being enforced or are mandatory. Many of these are sort of almost volunteer guidelines that employers are sort of making up through experience. What should we do to protect our employees? And unfortunately, what's happening is that we're seeing higher infection rates. There's also something new that we are also learning, that there is a stigma around folks that are coming out as positive around COVID-19. So putting all these pieces together in terms of
Mm.
no specific guidelines for COVID-19 protections, the stigma attached to potentially being infected at work, and workers dying without some adequate documentation system
Mm.
in the country, have all created a real fear for workers. However, this fear can sometimes lead to silence, and there's
Yep.
silence around really reporting to the employer, letting your employer know these are the issues, or I think that I can be more safe at work
Mm.
if you provided, social distancing. There has to be a complete reconsideration of the workplace to ensure that proper public health protocols are being followed in the workplace.
So I want to dig into some of the
Hmm.
specifics about the whistleblowing attempts, the attempts by folks to stand up, and the inadequate
Hmm.
response on the part of OSHA. But you mentioned something in your answer just now that I just want to underscore and focus on. We know from certainly reporting and data that's coming out that people of color have been disproportionately affected
Hmm.
by the virus, both in terms of getting sick and dying. And you kind of
Hmm.
pointed out something that I think is worth underscoring. Is there any way of showing that that disproportionate impact has come specifically either in a large sense, plurality, a majority, the huge percentage of cases, because of the way in which workers of color, especially in low wage work, have been impacted? In other words, they get sick in these workplaces disproportionately,
Yes.
and then they go back to their communities where, because let's say you're in a low wage job, you're likely going to be, for example, in a housing situation that is more compact, that's hard to do social distancing, for example.
Right.
Can we make
Right.
that interaction and that connection?
Yes, and the interesting piece of this is that we're really touching into issues that are systemic, that
Mm.
impact everyone. This is not, unfortunately, the reality is that COVID-19 does not stay in the workplace. So if a worker walks out, it doesn't stay confined in the workplace. The reality is that we're dealing with an infectious disease that, as soon as a worker who's not being provided the adequate protections at work, um, is at higher risk of being infected. If they turn out to be infected, walk out of the workplace, end up in their community, it impacts the community. This is an issue that should be of priority to everyone, really, because it impacts us so heavily.
Mm.
But yes, to your point, the reality is that the communities of color, folks who have low wage jobs, who work in high hazard industries, do not
Mm.
have the best quality of life and do not have the best housing in many situations. That this is something that we're also noting in particular with the farm worker community. Farm workers, when they're at work, you can notice that there's some social distancing happening. However, what happens is that when you transport these communities of farm workers who typically live in house situations that is also provided by the employers,
Hmm.
they're crammed housings. It's crammed housing. So you put them in tight buses and vans together, take them home. It's just like
It's the
disaster waiting to happen. I mean,
it's the coronavirus's best wish. If it had a mind and it was thinking for itself, it said, "Woo! I've
right.
got targets now because they're all crammed together." It's perfect scenario.
That's right. That's right. So,
Yeah.
it's an ongoing problem, and unfortunately, with OSHA is already, before the pandemic hit, OSHA, the Occupational Safety Health Administration, which is the agency that's responsible for enforcing workplace health and safety laws in this country, was already under resourced before the pandemic, meaning that there's not enough inspectors to go check out a workplace,
Hmm.
to, if there's a complaint by a worker, to go visit the workplaces and let you know, well, this is what your employer needs to do, or you get a citation if you're not following the laws. So before the pandemic, it would take years for OSHA to be able to inspect every workplace. Unfortunately, the reality now that we're at the pandemic, OSHA has not only not um, provided the right protections, it's gone completely AWOL.
Mm.
So we don't know that they have provided any citations to employers. I think they have been unresponsive to the complaints. And now any whistleblower protections have also been minimized because uh, 11C whistleblower inspectors have downsized.
Yep.
So there's more complaints, but there's been a downside of inspectors.
And you're an advocate, so you would say that OSHA has not been up to the job. But, and that's an important point, and you're an expert at this, but I want to reinforce what you're saying by actually quoting from the Office of Inspector General of the Department of Labor, the actual office that oversees
Mm-hmm.
OSHA, which basically confirms your point. And I'm quoting here, this is from the report. OSHA was challenged to complete investigations in a timely manner before the pandemic, and the
Mm-hmm.
potential exists for even greater delays now, which was the fabulous point you made just now. And this points to the reality that employers have always exploited this system. The AFL-CIO, as you well know, does this
Mm-hmm.
statistic each year. And I think roughly, I may not remember the exact number, but it would take 120 years or something like that for every
Mm-hmm.
workplace to be inspected by
Right.
OSHA, something
Right.
like that, on a
Right. Right.
good
Right.
day, meaning
On a good day.
pre-pandemic.
Right.
And
Right.
now
Right.
you
Right.
put in this pandemic situation where employers basically don't care because profit's the motive and this is what they care about. And for example, I just did this segment last week on the poultry industry. At one point in the poultry industry, which as you well know is one of the most hazardous industries that
Mm-hmm.
someone could be part of, and people are squeezed together, they put up saran wrap at one point because that was their response, employers' response to trying to protect workers. So
Right.
the question
Right.
to you is, there really is a reality that workers are living with a system that does not protect them on a good day, and it's just gotten worse now.
You're right. You're right. It's just gotten worse. So, what has been our response as worker advocates? So, it's interesting you mentioned, for instance, the poultry campaign. Our local COSH groups, our network of local COSH groups, they are on the ground. We are talking to workers on a daily basis. So, we know the reality. These are not reports that are coming from some report, from other
Mm.
reports. We are talking to workers directly. I can tell you that, for instance, our Western North Carolina COSH group, who's working intimately with meat processing workers daily, they have shared with us some of the horrendous stories of workers working in like the worst conditions, really, and just like and COVID has wreaked havoc in their communities. To the earlier point that it just does not stay in the workplace, it spreads through the community. So where we know neighborhoods where a lot of these poultry workers are living, in apartment settings or homes,
Mm.
again, it's not being contained. So the reality is that OSHA has been totally unresponsive to this. Now, what we have said is that this has also triggered some action among workers. Workers are saying, well, if government's not protecting us, if these agencies are not protecting us, we need to put more pressure on our employers now to make the right choices, to listen to us. And sometimes that's happened. We've seen it across the country. Teachers are also uh, doing strikes. They're saying
Hmm.
we're not going to reopen our schools if it
Yeah.
means the livelihood of us as teachers, but also our students and their families. And these collective actions are really making changes. So um, even though it looks really dark to say that OSHA, our government, is not protecting us, there is a lot of light and a lot of hope among workers organizing directly as collectives, as groups, and demanding the rights their rights and also the recommendations for workplace health and safety. I can tell you this. Our network also includes several public health professionals.
Mm.
We have doctors, we have organizers, we have industrial hygienists, folks that are very educated in being able to provide technical expertise around what makes a workplace healthy and safe.
Mhm.
However, I can tell you consistently, one thing that is always minimized is that the worker voice sitting at the table, being able to provide health and safety recommendations is key to providing these. So when
A-
you hear, I as a public health professional myself, I never assume any means of expertise. I haven't myself ever worked as a construction worker,
mm.
but I can tell you this, a frontline construction worker can very much articulate better than I can what their needs are at the workplace, what protections they need, how they can shift their process work for allowing them to provide some of the social distancing guidelines, some of the
Mhm.
mask protections, just isolating workers from each other in this particular case. So again, workers at the table is also always a key piece.
And the reality is that part of the issue of having enough uh, ability to stand up and speak out is the reality that unions are weaker in the country now. So you've got this pandemic in one sense, and parallel to that is the labor movement is quite weak, and especially, unfortunately, in some of the
Mm-hmm.
industries that are especially dangerous. The poultry industry, for
That's right.
example, comes to mind, and other places. So there is not a collective voice that
No.
is powerful, and you then leave workers to stand up on their own, although collectively they can find each other and stand up. And
Right.
where there have been some changes, as I've noted in past segments, it's because workers have collectively stood up to oppose these dangerous
That's
conditions.
right.
Now, one of the things that I'm wondering is how subtle and how dangerous is what employers are doing in a less explicit, threatening, blackmail way. And this way, I've heard lots of stories where workers are simply going to work in bad working conditions because, number one, they're afraid to lose their jobs if they
Mm-hmm.
don't show up. And second, employers are actually encouraging people to come to work, sometimes offering them bonuses. That was true in the poultry industry.
Mm-hmm.
Workers were given a bonus, say $500, which frankly,
Mm-hmm.
$500 is not worth your health or your life when it comes to a
Right.
pandemic. But I think some of the pressure that workers are feeling, and tell me what you think about this, and whether that's actually something you can protest under OSHA guidelines, that they're being essentially forced through um, a little bit of a carrot and sometimes a stick to come to work.
Right, right. Well, under OSHA, the law itself states that any worker has a right to refuse work if it's in an unsafe or if there's a condition or there's an imminent danger.
Mm,
Now, this is why it's so important for OSHA to do its due diligence and ensure that inspections and investigations are done quickly and responsively. Is also the importance to note that many of these workers who do speak up have that fear of retaliation. However, sometimes when you do create this culture of fear, that's when you know the employer is winning, and that's why we super emphasize the importance of collective action. And I have to say, and I have to repeat that. And I understand that we have less unions. Unions means a collective voice. It typically is representative of a collective worker organization, but we are seeing workers inspired across the country, whether with no unions, coming together to ask employers for, making their demands around workplace health and safety. So you're right. I mean, we do have those the employers who are offering these bonuses, these attractive gifts to be able to keep workers and sustain them. But this is the importance of, again, workers coming together and seeking support. Now, this is also an important role for our local COSH groups. Our
mm,
local COSH groups, many of them are connected with unions, but also I want to emphasize the important work of worker centers, which is another sort of model that represents a lot of low wage, high hazard workers in many places across the country. We know that some communities through their churches are organizing workers, ensuring that they also get the resources that they need. So we need to do what we can as advocates to pressure our political representatives to ensure that we have more resources
mm,
into OSHA.
mm.
But in the meanwhile, because we know there's urgency to these issues, we have to also remind workers that their collective voice is important. And we are hearing stories of a lot of success across the country. I mean, just in Massachusetts, we know our local there was, you know, we know some workers in the state of Massachusetts had asked the Department of Labor to ensure that whistleblower complaints were handled in a timely manner. What happened is that around this pandemic, they developed a new form that would expedite these complaints. And this is all the work through, again, worker advocacy that's
Mm.
happening across the country. That's in some cases being supported by many of our local COSH groups.
Well, your COSH groups are doing very, very important work, and
Mhm.
certainly that's been true before the pandemic. So thanks for really updating us. And we want to, on this show, keep up on this topic. So feel free to come back on the show. We'll do another segment. And thanks for being with us today.
Thank you so much, Jonathan.